to do all of the above. I mean, we need a massive stimulus. The first thing we need is a cash infusion to ordinary Americans, many of whom who've seen paychecks reduced, many of whom who've already filed unemployment insurance claims. We need to extend unemployment insurance. We need to beef up the paid leave. The House took the first step. But as you know, large corporations were excluded. They shouldn't be. And we need a guarantee of paid leave, not just for the coronavirus, but if people are sick. We don't want them coming into work. So there's a lot of work that remains to be done.
But what is happening? What kind of pressures are being brought on the House? Let's talk about that paid leave. Yes, in the end, apparently with Nancy Pelosi negotiating with Mnuchin, the exemptions were made for companies that had more than 500 workers or less than 50. What we're talking about, at first, the bill passed, would affect maybe 20% of workers getting paid sick leave. But now it sounds like it's going to be much less than that.
Well, it's inadequate. There's no doubt about it. That said, Amy, I mean, every House Democrat believes in paid leave and believes that it should apply to companies larger than 500. The problem is that we're negotiating with Trump and McConnell to get anything done. I do believe, though, that we have a lot of leverage. I mean, this president needs a deal. The economy is on the verge of a real crisis, and we should make sure that we are pushing for things that are actually going to help. And we know from all the economists that that means paid leave. It means getting money into the pockets of those who are unemployed and the working class. So we need to re-explore this. And in this third package, we do make sure that we don't have the exemptions for companies over 500 and make sure we're reimbursing not just for coronavirus, but for a period of up to 2 weeks if there are small businesses that need that reimbursement.
So talk about what the White House is now proposing. At first, President Trump, I mean, until in the last few days, he's been saying who even knew anything like this could happen like a month ago, referring to the pandemic. Now he's saying he's always known there was a pandemic. And the White House and Steve Mnuchin are proposing this $1 trillion bailout, originally asking for much less. But who will profit, in fact, in this? What guarantee, as he has had a stream of corporate executives at the White House over the last few weeks, that it's the workers that will benefit, that there will be strings attached to the massive amount of money that could transfer to U.S. corporations and wealthy individuals?
Well, what we need to do is have, if we are going to have $1 trillion, have that directed to increasing unemployment insurance, have that directed towards direct cash grants to every American who's making under $150,000 or $130,000, so that people actually who need the money are getting it. What we shouldn't have is large bailouts for industry. Frankly, what the president ought to be doing is invoking the Defense Production Act so that we can have some of these industries producing ventilators. We have a huge shortage of ventilators here. In Britain, they've converted Rolls-Royce factories to producing ventilators. What we ought to be doing is moving our economy to a footing where we can produce medical supplies. So the last thing we need is bailouts for large industries that look like just a handout to shareholders. We need to give the money to working class Americans, to Americans that are hurting, to the poor and low wealth. The Reverend Barber talks about 140 million Americans who are double the poverty line or less. That's who needs to get the money. And then we have to reorient our economy towards producing things that are going to help us deal with this coronavirus crisis. If someone has other symptoms, if someone is ill, you don't want them to be going to work. You don't want them to avoid going to a doctor or going to a hospital or engaging someone even on the phone or through telehealth because of a bill. And so for at least a period of 3 months or 6 months, we ought to say that the basic health care of every American is going to be covered. This is going to make us safer because we're only as safe as the least insured among us. And we are hopeful that this is something that everyone can get around. I mean, it's not, as Senator Sanders said, Medicare for all. It's an emergency 3 to 6 month plan to give people health care. We've seen in a country like South Korea that has been far better at testing based on a single payer approach.
Testing. Let's talk about testing. let's talk about the devastating lack of tests that are available to people, despite what the president keeps saying, that every American can get a test. We know that the lack of tests are fueling this pandemic in the United States, that public health officials can't see where there are outbreaks, that people can't know whether they have tested positive, though have symptoms and are desperately trying to. I mean, it now has been documented that the U.S. could have used the World Health Organization tests like South Korea and other countries. They didn't. They put out a flawed test of their own. And now, can you tell us, is there an accounting of where these tests are? Can they be made available? What can you do as a Congress member?
Well, Amy, it is the biggest national scandal that we did not use the World Health Organization tests. I asked in committee both the director of the CDC and a senior official at the NIH, why did we not use the World Health Organization tests? And they were unable to give us an answer. They had really no explanation other than, I think, an over-reliance on everything had to be American-made, which is fine if we had the capacity, but we didn't because we had systematic underinvestment in public health. Our CDC budget should have been much higher. But the point is that at some point there has to be a reckoning why we didn't use those World Health Organization tests. It was probably the biggest mistake made. Now, all of us in Congress are pushing for tests to be widely available. There has been progress on these tests that should be deployed. The challenge is we're probably still a week or 2 weeks out. And then we need telehealth. And some of us have been calling and have a plan with COVID Alliance to get a national telehealth center, because we don't want every American rushing to go get a test. You have to first see if you're symptomatic and have the profile that would require a test. And a lot of that can be done through telehealth by consultation with doctors and nurses so that we don't overburden our healthcare facilities. Unfortunately, that hasn't yet been set up.
And what about the Federal Reserve of Emergency Reserve, the devastating effect of this on healthcare workers and the kinds of just personal protective equipment that people can have access to?
It's mind-boggling, Amy, why we don't invoke the Defense Production Act to do two things. First, we ought to be producing as many N95 masks as possible. I've heard so many stories from my district of doctors and nurses. They only are having one mask that they're wearing throughout the day for different multiple procedures, and that's just frankly unsafe. We need to protect the people who are on the front lines of this crisis. And second, as so many experts have said, we are at real danger of running out of ventilators. And if that happens in this country, we're going to have awful choices about who we save and who doesn't get saved. And I don't understand why there's not outrage and a cry in this country to turn every possible production facility into producing ventilators so that we have as much supply as possible. That really ought to be an urgent challenge. There's 57 members of Congress who have written to the president to do that. But this shouldn't be about politics. We just need great production of ventilators and production of masks in this country.